Hello, everyone. I know that we have a few folks who are here really almost every day. And it is the second to last salon in the series. We started now really, well, more than 5 weeks ago. And on Saturday, we're going to be pivoting from a daily salon series in which we kind of like feature someone who's been working on a COVID-19 related issue to more of a workshop type situation where we actually try to kind of like pull a few people that we've featured over the past 5 weeks and a few others together to try to make sense of COVID-19 right now, but also to try to kind of show ways out in which we could perhaps think now about like longer changes ahead. And funnily enough, one of the I think one of the first sessions next week will be on I think, let's see, one of the first sessions next week will be specifically on how we can champion this kind of like incredible culture of civic responsibility that we see emerging. And I think you are really the prime example. I think, maybe I can like lead a little bit into the introduction now, but I remember like specifically at the time when, maybe 5 weeks ago, maybe even a little longer when, everything kind of like started unraveling super fast after like it unraveled for a while slowly and suddenly it all sped up and unraveled very fast. And I remember just my friends kind of like my whole Facebook feed was full of different PPE efforts and different people trying to coordinate different people. And then like on a meta level, there were a few folks who were trying to consolidate different PPE efforts. They were then trying, and then there were a few folks who were trying to consolidate those folks. And then eventually a friend of mine shared GetUsPPE finally. And I was like, oh my God, this is exactly, I think, the type of kind of like of effort that is really hard to pull together, of like trying to see a little further of like not only who is in need of PPE equipment right now, who can donate, but also what are the different projects out there? How do we make sure that they don't duplicate effort? And so I think that, you've really kind of like launched this fantastic effort of kind of like consolidating and coordinating a variety of different efforts that are in dire need of help. I think it's a really remarkable effort put together in an incredibly timely fashion. I think probably with a ton of volunteer work behind it, and much volunteer work, I'm sure. And I think one of the things that I would like to avoid is that as we are thinking about perhaps like a few more of the long-term changes that may be ahead, I definitely don't want us to lose track of the fact that our attention spans may be short, but efforts like PPE in hospitals, but also in prisons and so on and so forth, that is still required, very much so. And so I'm really happy to have you here right now to kind of like just make people remember that actually there's still a ton of work that is a kind of immediate response that could be done right now. So I don't want to take away further at all from your time. I'm terribly like happy to have you here, Valerie, and you share a little bit about GetUsPPE, then we may have a few questions, and then I'm hoping that we get to how we can help you as best as possible. And I'll share a little bit about your bio and the topic of the title, the topic of today in the chat. But for now, thank you so much for joining. And I'm looking forward for what you have to share with us. Thank you.
Yeah, thank you so much for having me. And thank you so much for putting together this series. I was looking through some of the topics and I wish I'd known about this a little bit earlier. I would have liked to join sooner. In terms of a little bit of background about me, I'm both emergency and critical care physician in Portland, Oregon. Currently finishing my last year of training before I actually start my first full-time job in Chicago this coming July, August. I actually got interested first in PPE because of my concerned partner nudging me to really take a closer look at what was happening in China and what their approach to COVID was. And, when the CDC first released recommendations about how to approach patients that we suspected had coronavirus, before we even had that many cases in the United States. So this was when we still just had the incident cases in Seattle and Chicago. CDC came out with guidelines about what we should be using. And in particular, they mentioned that we should be using respirators, which I thought was a totally reasonable approach to a disease that was similar enough to SARS and MERS that we should be really concerned as frontline providers. And then about a month later, they changed the recommendations. And they started saying that we should just wear surgical masks. And the reason that they gave for that was that we were going to have a PPE shortage. And it struck me as short-sighted to prioritize, protective equipment, things that are, can be reproduced, can be manufactured. You can do other things. You can extend their use. Typically our approach to N95s is that they're one-time use. We wear them into a patient room and we take them out. When we come out of the room, we take them off and discard them in the trash. And it seemed very short-sighted to prioritize a material thing over a irreplaceable thing, which is frontline healthcare providers. So physicians, nurses, and respiratory therapists, emergency department technicians, all these people that, trained for years to be able to do that job. And now the CDC is saying that we can not use the highest level of protection to make sure these people are safe. And that just really got under my skin. And I looked into it further, and China, it turns out, had taken 42,000 healthcare workers from other parts of the country. They brought them into Wuhan, and they put them in full body suits, respirators, eye protection, gloves, obviously. And per reports from China, not one of those healthcare providers became infected. Similarly, in Hong Kong, there's a study that was published about a month ago now that showed about 300 healthcare workers who all had respirators when they were treating patients that had coronavirus or were in the room with a patient with suspected coronavirus. And again, not one of those 300 healthcare workers became infected. And it just highlighted the issues that these recommendations from the CDC were bringing up. And that led me to write basically a letter that I shared with Esther Chu. Esther Chu of very famous within the emergency medicine circles, does a lot of research in health inequities, has spoken online, both television and Twitter, about basically racism in medicine, both from the patient care side of things, but also the provider side. And shared that with her, and she said, we have to publish this. Just the day previously, she had come up with the hashtag GetUsPPE, and I was not aware of that. Actually, her hashtag was GetMePPE. GetUsPPE came in later, and I wasn't aware of that hashtag at the time. But I sent her my letter, and that day we submitted it to some newspapers, New York Times, LA Times, just trying to get some traction. And unfortunately, nobody bit. But fortunately, this was now the 18th of March. Megan Rainey emailed Esther and said, we're launching a website based on your hashtag. We want to turn it into a petition. Do you have somebody that can write a letter? And so we already had a letter. And so that letter became the basis of what we kind of, we crowdsourced editing and posted it on the 19th. And that's what launched the initial Get Me PPE website. And then I believe it was the 19th or 20th when Shuhan He, based out of Mass General, decided to come up with the GetUsPPE website, which is now basically the algorithm matching data collection, both on the supply side and the people that need PPE, whether it's hospitals, nursing homes, EMS agencies, and trying to match them to each other. So, if you put in a submission, I have this kind of PPE, then we contacted them. Initially, it was all done manually. We contacted them with people that needed that kind of PPE. And most of the time, it had to be delivered by the person that had it. Although now we're able to do some deliveries, especially in the Bay Area where we have a little bit more infrastructure. But that's one of the things that we continue to try to address is the logistical side of how do we get the PPE from where we know it is to into the hands of the people that need it. So we're partnering with different organizations now as well. Project N95 came up around the same time that we did. They've really been working on identifying suppliers that make PPE, both locally in the United States, but then also in other countries, and kind of working to verify different supply chains. There have been, unfortunately, a lot of false leads, people who are unfortunately dishonest, trying to take advantage of both hospitals and healthcare providers during this international emergency. And so Project N95 is more focused on trying to make sure that we're utilizing known supply chains, but then also verifying new supply chains as they come up. So that's just a little bit of background. Anything in particular that I can kind of tell you all about, or
how many? Do you have an idea of how many you've matched so far, and yeah, at first I'm assuming that at first it was more matching, and now you can also donate, right? Like there's individual, like specific channels on how you can kind of like contribute, right?
Right. So initially it was definitely matching people that already had PPE supplies. So like construction companies or dentists' offices. We even had some like television studios donate their PPE to us that we were able to distribute kind of more around I think the Southern California area. Since then, those PPE supplies have dwindled, and we're now shifting into kind of two arenas. One is the maker community. So there's a lot of people using their 3D printers to make face shields. That's been really useful. Even, not technically the maker community, but Nike here in Oregon developed their own face shields from, using their materials that they would typically use in shoes. And they've made clear face shields, both kind of the standard face shields that are just basically splash guards, but then also specialized PAPR shields, PAPRs being powered air purifying respirators that basically function to create a positive pressure that blows air over a person's face, and then the mask kind of keeps any splashes away, and then the air blows out backwards. So those are super nice because we were running low on the face shields, because most of the face shields for those are not reusable, but Nike's are reusable, which is really nice, much more durable than the other ones. But a lot of industry is trying to come up with ways that they can help. Initially when I got into this, I was hoping that the federal government would activate the Defense Production Act and try to coordinate these efforts by basically identifying what the needs were by talking to states, who then would talk to the hospitals. Hospitals would communicate with states what their needs were, whether it was PAPR face shields or surgical masks or gowns, and then the states would collate all that information and share it with the federal government. Federal government, ideally, in the best case scenario, would then talk with industry and kind of direct industry. These are the things we need. GM, great, you're going to do ventilators, wonderful. Nike, we love that you're doing the face masks, you keep doing that. But then all these other companies that are trying to step in and come up with new business ventures, even buying machines, great, we'll support you in buying that machine so that you can help us respond to this pandemic. And unfortunately, that never happened. That last step where the federal government stepped in and coordinated the great American industrial complex has just been happening in hiccups and bits and pieces. And that's been really frustrating to watch. And so that's actually where I come in, is trying to raise awareness about the Defense Production Act as this law that came into being around the Korean War and is basically built around national defense. And this pandemic is very much an issue of national defense. And reading through the text of the Defense Production Act, it's clear that it's almost like this was made for a pandemic, talking about how we can basically use the federal government, not just to direct industry, get into contracts with industry to produce the things that are needed, but then to use national resources to distribute those products as well. So using agencies like FEMA to take PPE that's made in Oregon and distribute it to New York. And right now that's really only happening on a state-by-state basis. So, Oregon Governor Kay Brown heard that New York was in need of ventilators and said, great, we have some spare ventilators because our outbreak's not bad yet. We're going to ship you our spare ventilators. but really that should be happening at a national level so that we're not having this piecemeal response that builds inequity into our system.
Yeah, we had a few, I think, talks that were mentioning like a similar kind of like call to action for the federal government, one on accelerating vaccine production now, and then yesterday one on tests and contact tracing, where all speakers kind of like just agreed that there's this insane vacuum that they wouldn't have expected prior. It makes no sense that the government isn't stepping in. That's exactly what it's kind of like what it's there for. So is there a good country to point to that really kind of like stepped up its game in that regard? That could be used as a good role model in that area.
Absolutely. I mean, Germany, I think, is the role model in that regard. I just learned recently that Angela Merkel is also a scientist, so I suppose we shouldn't be surprised that their response has been swift and
PhD in physics.
Yeah, and impressively adequate, if not an exemplar for the rest of the world. They stepped up production of testing from the very, very beginning. I think even back in January, they said that we need to be prepared for this.
It's not just Merkel, right? With the exception of Allison, the German people are all about following rules and stuff like this, aren't they?
Yeah. And in part too, it's also because Germany had a company that was already making these kinds of tests. So it's a little bit like they're cheating because they are able to just use a company that they already had and they're, within their borders to step up production. We have a lot of laboratories in the United States that are able to do similar kinds of production. And I think if we had recognized the threat early on, or at least I think the threat was recognized, and unfortunately people that were able to do something about it chose not to do anything about it. But reading back the New York Times today, I don't know if many of you saw this in the New York Times, but they published a set of emails dating back to the end of January, I believe it was January 28th, between a lot of high-level officials and epidemiologists, looking at basically kind of a timeline of their thoughts on this pandemic. And I think if we started listening to them early on, we could have responded to this in vastly different ways. We could have started ramping up our ability to test early on, and unfortunately that didn't happen. Similarly, we could have ramped up production of PPE, and that didn't happen. There's so many missed opportunities. It was not just, as you mentioned, not just personal protective equipment, but also testing, also vaccine production. Ventilators, luckily, I think our ventilator capacity in New York ended up almost being sufficient. I did still hear about a few patients ending up with basically two people on one ventilator, which is definitely not ideal as a critical care physician. It makes it very hard to care adequately for both those people. But by and large, the ventilator issue was okay. So we still have a long way to go, though. This is not going anywhere, and personal protective equipment is going to continue to be an issue because the world supply chain is just not built to handle this kind of large influx of demand.
So one thing that I think first, one thing that immediately came up, at least in the forecasting community, was there's this article that was once written called "There should be a fire alarm for AI safety," meaning that for AI, for example, you don't really know when kind of like let's say a potentially dangerous state has arrived, because there is just no fire alarm. And the purpose of a fire alarm is not only that you hear that there's a danger, but that everyone else can coordinate on a danger. So now everyone has common knowledge. There is a danger. This arbitrary threshold has been breached, and now we can all kind of like go into emergency mode. And it seemed like for a pandemic there should have been something like a fire alarm, after which it's crystal clear that okay, we reached a certain threshold of X. Now we can step into a different type of action, right? But it didn't really seem to transpire in that way at all, right? Like it was very uncoordinated. People are still kind of not quite clear after when it was actually time to do anything about it. And so I think, that this kind of coordination issue was still a big one. Yeah. I was wondering more on a personal level, I remember at the beginning, when it was a few of my friends had, were trying to tap into their connections with kind of like personal suppliers in China, to just kind of like donate, like kind of like pool money and then get a bunch of masks and other PPE equipment shipped over. But very quickly, if you looked on Alibaba, even just a few a few weeks ago, you had like a whole host of masks and PPE equipment, and it even said FDA approved. But it's really hard to see which one is actually real and which is a fraud. Do you have any tips of how to navigate that space? Because if you're kind of on your own, you can only go by trial and error. Like, have you had any experience with that at all?
Yeah, at this point, I would definitely say don't try to navigate that on your own. That's why Project N95 has come about, and why we've partnered very closely with them. We're basically sharing databases now about PPE needs. And I would highly encourage anybody that is in need of PPE to go, well, first I would contact your state. Every state has their own emergency coordination office, EOC basically, and the states should at least be aware of your PPE need. If they're not able to respond to it, then the next step I think would be to go to some of these organizations that have stepped in to fill the federal void, including GetUsPPE. And GetUsPPE is really designed to work with kind of smaller organizations, EMS agencies that, are not as big, quite as big as somewhere like Multnomah County, which serves the Portland metro area, or, skilled nursing facilities, rehab facilities, nursing homes. So GetUsPPE is really targeted more at addressing some of these health inequities that we saw as being a problem from the very beginning, and helping those smaller groups try to access PPE safely in ways that they're not going to get swindled. And then Project N95 is more targeted at larger, healthcare facilities, the larger nursing home systems, people that are able to place bulk orders. And so, through the combination of those two efforts, we're able to basically address most of the needs. But unfortunately, again, this is something that we would have preferred the federal government at this point would have stepped in to do. And it's I think continues to be a little bit shocking that FEMA has not contacted us and said, okay, great. We love this database. We'll take over from here. So,
yeah, well,
I think there's actually a question I wanted to address from David.
David,
you're welcome to ask it if you want.
Sure. I think there's, the chat box is pretty clear. Just given the proclivities of the White House for arrogating and usurping powers reserved traditionally to other parts of the government or the people, why do you think the Defense Production Act was not invoked? What do you think the reasoning is? Presumably you've looked into this in order to organize tactics and persuasion, trying to build a coalition.
Yeah. My theory for why it hasn't been invoked is because Trump has people who are advising him that really believe in state autonomy. And that's been their approach from the beginning of this pandemic, is that it's the state's job to respond to crises like this. It's not the federal government's job to act as a distribution center. And when he phrases it that way, it's almost believable, like the federal government shouldn't act like a distributor. And yet, the federal government has stockpiles, but then their response is, oh, the stockpiles are for us. And that just goes against everything about what a federal government should function as. The federal government should function to respond to national crises. And this obviously, as a not just national but international crisis, would qualify in that regard. You also made the point in your first question, as somebody who has been trying to consolidate power into the executive branch since he took office, why would he not want to activate the Defense Production Act, which would consolidate even more power into the executive branch? And that's what my hope had been at the start was, reading the text of the Defense Production Act. I said, oh, this is great. Like, Trump would love to get behind this because it'll just give him, more power and latitude in how to respond to this crisis. And, if done well, could, improve him in the polls. And, it might be that they made the calculation early on that there was no way that they could respond to this threat in an efficient way such that they would come out on top in the polls. And so instead they took the tact of, let's let other people respond and then blame them when it goes wrong.
And take credit as if he's marching in front of a parade he didn't organize, if and when things go well.
Just like every other politician that's ever been in office in this country. But I hear your point. I mean, I'd like to just maybe be a little bit contrarian here for a second and say that
please.
I think that, I mean, I don't know, I'm just speculating here, but it seems to me that they know, Trump and his people know that it's a terrible situation that's unfolding, that's undoing, I mean, it's like undoing decades and decades worth of quote unquote progress in all sorts of areas. Yeah, they don't want to be blamed, but I've gotten a lot of insight myself, and I, please don't eject me from the Zoom room for saying this, but I've gotten a lot of insight myself by listening to Steve Bannon, who continues to podcast and blog on this stuff and was the first person who brought this whole pandemic to my attention back in January, saying this is going to be major, it's going to grow exponentially, it's going to collapse the economy. I mean, he kind of saw it all, and it's all come about. And I'm not saying I think Bannon is a great guy. I'm saying he's a relatively smart guy, and he had a lot of insight in this case. He turned out right in almost everything he predicted. Now, I haven't listened to him in a few weeks, so I don't know what the hell he's ranting about now. But I will say that Trump listens to him still. I mean, I know that supposedly Trump fired him, but basically Bannon was his smart guy, and he still listens to Bannon, and Bannon still supports him. Strangely enough, even after supposedly they had this falling out, and he was fired, Bannon always, well, at least up until a few weeks ago, always praises Trump. So I've at least found some insight into what the Trump administration is doing by listening to Bannon. And according to Bannon, they're scrambling and they don't really know what they're doing, and it's out of control. And, I think all these ideas that they're nefariously plotting to, take over authority and blame somebody else for the problems, to some extent that may be true, but you can sort of, I think, I'll shut up in a second. I think you can sort of see this with the way Trump treats Fauci. He's like, for once, Trump knows he's kind of out of his depth, I think. And, that's not great for this country, but it's at least somewhat heartening that he may have an inkling that he's out of his depth.
Yeah. Yeah, maybe the issue was that he didn't know who to trust. And, Fauci was in a position where he was able to kind of step in and be that person of reason and be able to step in front of cameras and, handle questions coolly, and yet also manage to respond to Trump in ways that, didn't get him in Trump's doghouse, for lack of a better analogy at my fingertips. I'm pleasantly surprised, I suppose, that Fauci is still.
He's not fired?
No, he's not fired. Yeah. So I guess I wish that they had chosen to rely more on Fauci and people like him that were already within systems like FEMA, like, Health and Human Services. These people are, career medical professionals and experts. And we had the knowledge, and it's apparent in the stream of New York Times emails. We had the knowledge and awareness to know that this was going to be bad in January, and we knew the ways in which we needed to respond based on previous simulations of similar events. And the White House just dragged their feet. And maybe it's just distrust of science. We've seen that repeatedly from the Trump administration.
Can you perhaps give us because I'm sure that you must have that kind of almost at your fingertips. Can you give us just a scale still of the problem right now? Because you know, is it much improved? Is there only a little bit to do in terms of PPE coordination? Is it still like just a lot and ramping up? Because yesterday, the crazy thing with testing that I learned was we are definitely not ramping up testing in the way that we ought to.
Right.
Like, you know, you think from by now on that people should have realized, and like now we're just really going to town on testing, but it doesn't really seem to be happening at all. There's, you know, like there's like very, very little growth. So how does it go with masks? Is it now, because you said you're still waiting for FEMA to like knock on your door, but you know, do you feel like you can get a grip on the problem, or is there still just like a lot of help needed?
There's still a lot of help needed. And part of the problem is that healthcare providers have been directed to basically reuse the PPE that they have. So as I mentioned earlier, you know, standard protocols with respirators is that, and surgical masks for that matter, is that you wear them once, you know, into a patient room, and when you come out of the patient room, you discard them because they're a contamination risk if you then take them into a different room. And we have basically been instructed in some cases in some cities, some hospital systems, that there's not enough respirators to even allow people to wear more than one mask per week. And so, yeah, it's appalling. And in most cases, we've gotten to the point now where people are basically using one respirator per shift per day. And that seems more reasonable. My approach kind of from the beginning, because I was a little bit more aware of the situation, and my colleagues, were also becoming more aware. We all started saving our respirators from the very beginning. So even though we were only using one per shift, we didn't throw any of them away. And we haven't gotten to the point where we need to reuse them. But, you know, I'm not sure if I mentioned this earlier, but if the CDC had given us guidelines from the beginning saying that, you know, an alternative to limiting respirator use is instead coming up with protocols to reuse respirators or to have extended use for them, then we can continue to use them for every suspected patient. So, you know, and that's the situation we've seen now, which I think is the appropriate thing to do, which is, you know, extended use. A week of extended use is too long. The approach that I think is most reasonable is probably, you know, if you're in a severe shortage, people get issued, you know, somewhere between 3 and 5 respirators, and then they rotate them every 3 to 5 days. You know, basically allowing enough time for the virus that might be on them to die if you just kind of leave them alone in a, you know, somewhere where you can kind of circulate. So obviously that takes a little bit of space where, you know, for me, that's the trunk of my car. But, you know, in a hospital, it could be a closet where these things are stored. You know, each person can kind of have their own paper bag system, but obviously it takes space. So the PPE issue is still there. I think that there is some disparity between what providers on the front lines are seeing because they're being told by hospital systems that they need to be reusing their PPE, and then what hospitals are then telling their states. Because what hospitals are telling their states is based on their models using these extended use protocols. And wow. So, yeah. And so that's problematic because it's not the safest thing for providers to be reusing these masks day after day because, you know, especially this. What's that?
Why would they downplay it? Why wouldn't they just play it safe?
Yeah, I'm not sure. I think that they're grasping at straws, and I think that they're following the CDC's guidelines. And, you know, the CDC is basically making these recommendations that still, even now, the recommendation when approaching a patient that is suspected of having COVID, that a simple surgical mask is fine. And that's, you know, on the CDC website, and that's the protocol that hospitals are still following.
Wow.
And based on experiences in not just China now, but Italy and Spain and New York, we're seeing that simple surgical masks are not 100% safe for healthcare providers. And in these situations, you need to be 100% safe for healthcare providers because you're going to start taking away your workforce, and not just, or you could take away your workforce, but those people are going to go home and they're going to infect their communities, and they're going to become vectors, and they're going to become kind of epicenters of outbreaks themselves. And so, providing appropriate PPE is still critical, and it's disappointing still that the CDC is not taking the approach that, healthcare providers are the most important resource we have, not masks. And so that's one of the things that I continue to advocate for, is that the CDC needs to update their guidelines to reflect best practices, not based on supply chain, but based on science.
Yeah, I think David had a question on reuse of PPE equipment as well.
Yeah, so in the last week, I've been exposed to a variety of informed opinions and claims about extended use of N95 masks in particular. So on the one hand, for protection against fairly big particles, you can wear them all week. So people at Burning Man, people with respiratory, asthma and irritation can do pretty well, even when the filter is clogged and it's a big mess.
Mm-hmm.
So that's claim one. Claim two came from a clean room engineer and Manu Prakash at Stanford, who's a part of some collective that's working on PPE and alternative materials and deep dive on airflow testing and all that kind of stuff. And they said a couple of things. One is that to keep the smaller aerosol and smaller droplets out, an electrostatic charge in the coated papers is important, and it doesn't last a whole week. It's not clear exactly how long it lasts.
Right.
Second, the mechanical compliance of that which is required for fit with the way that the standard N95 comes up, not as modified with wire ties and rubber bands and clever things that I'm sure will spread like crazy among PPE lives on the line people in the next few weeks, that the mechanical compliance and the fit degrades pretty quickly as well. So that the two issues of the coating and the fit, which are pretty hard to just sort of look at and suss out, and which a lot of casual use of N95s or even occupational use outside of medicine obscures. So I think what's needed is take some of those masks that have no live virus on them because they were sitting in your trunk for 3 days and modest temperatures, and actually test them, send them to a lab, and also do the qualitative tests with the sniff and taste tests that are qualitative, where a physician puts it on, or a tester puts it on and then sniffs something gross. And if they taste the bitter thing.
Getting out of that sniffing stuff.
Pardon?
We were doing so many fit tests, we ran out of the odors that were necessary to do them.
Okay.
Yeah.
The aquarium pump will help you guys. Anyway, with essential oils and, okay. Anyway, I think for valuable information among the opinion elites and to stimulate innovation and creativity, because we are not going to produce billions of N95s. That capacity ain't going to happen, and there's a case to be made that that's what we need this year.
Right.
So given all that, it would be really good for frontline workers to have better information than I have right now. So you may have it, you may know the answer to these tests, but I'm just saying, I really want to know what would the tests show, or what have tests shown about mask N95s in particular used way beyond their recommended and assurance standard duration. Yeah.
I would love to be able to say that there is research on that. And what I have looked into, at least as of about a week and a half ago, is that there wasn't any research on it. I know. It's really frustrating. I've actually talked with some folks here at Oregon Health and Science University to try to get that research done. And thus far I've run into roadblocks, but I'm still hoping, and especially now, I think your idea that I have a bunch of these masks in my car, would they still be effective against this virus if I put one back on, is a great point. Certainly, the extended use typically is about 8 to 12 hours, depending on a person's shift. And I've heard from, some people that certainly for a regular surgical mask, wearing a surgical mask for 8 to 12 hours is just not going to work, because that thin piece of filter just gets too moist and it stops working.
Right. So there's humidity, fluid containment issues, and then there's apparently some effect of carbon dioxide itself on this stuff. So you gotta, anyway, it was very confusing.
Yeah.
I can put you in touch with someone who is reporting information from where the Lompoc prisoners are, and the nurses had to shift after 6 hours, or their masks were no good, and they were getting sick.
Interesting.
So I can put you in touch with those folks.
Yeah, that'd be great.
It's really, really important, I think, to get the answer to that question.
It's super important. Yeah.
Yeah. I think to mobilize Congress, engineering schools, and all these sort of people who don't, have goodwill and good intentions, but haven't got something to chew on. And the other key thing, I think, is make sure, because of the scamminess of, last minute Chinese manufacturers and elsewhere, that they're tested with the flow rates of a panting, nervous, excited patient or healthcare worker who's just like been bending over or helping lift a bariatric patient, off a gurney, something like that. So those flow rates for the filter tests are really important. Yeah,
I agree. And, looking through, when I did my research on it, I was looking through the 3M website at how long they basically advertise their filters as usable. And the best information I could find was that once you opened the package, and these were the screw-on filters for the reusable half-face respirators. So these are the ones more typically seen in like industrial settings. Mm-hmm. Although I'm sure you've probably seen photos now of healthcare providers wearing the respirators, either with the boxes on the side or the circular filters. And in both those cases, 3M recommended a 6-month shelf life once the packages were opened. But again, what sort of usage is happening during that period of time? And I think that is a huge question that we need to answer. How long can somebody be breathing heavily through these respirators and have them still work to filter out viral particles? You brought up the issue about the fibers being electrically charged. And, once that charge is dissipated, if you let them then rest and perhaps, allow the moisture to evaporate, can that charge be, renewed, or, is it totally kaput? And that's the frustrating thing, is that we don't know yet. I did read in an article, I forget where I read it, but that the inventor of the N95 respirator came out of retirement to try to figure out ways to clean them and reuse them. So, I'm hopeful that we're going to have answers, but like all things, science takes time. And, I think it's going to take a little while before we can really figure out the answers to some of these really important questions. But I know people are working on it. If you know people that are interested in, working on this and sharing information, I'd be happy to hear from them and try to get people connected.
All right. Thank you, David. We have Wilson as well with a more general question on the PPE situation today.
Yeah, let me turn on. Hello. Hey, hi. How you doing?
Hi, Wilson.
So yeah, my question is, I don't quite understand this. Why we have so much difficulty making the N95 masks. First of all, are we caught up right now with our N95 supply or demand?
No, definitely not. So just to give you some ideas on numbers, did you have more questions you want me to answer?
Yeah, and then I want to understand the kind of the what it takes to make one of these masks. I mean, what are the physical principles? Why is it so hard to make them in the United States? Why are we relying on China to kind of ship them over here? Why don't we have the manufacturing base? And how can we do that in the future going forward?
Yeah, great questions. So to address the first question, N95 production in the United States is estimated about 1.5 billion annually. And then our typical usage of N95s is about 5 billion annually. When they have done pandemic simulations in the past, and they've gone through different scenarios, they've estimated that, in a kind of intermediate demand scenario, we would need somewhere between 3 and 4 billion N95s. And that's just an intermediate demand scenario. When you get up to the maximum demand scenario, it'd be about 7 billion masks. And that would be just in a short period of time. And so we've now taken our typical annual usage for our country and we've shoved it all into about a 1 to 2 month period. And so that's the first problem. In terms of addressing why this is an issue in the United States, there's only a few companies in the United States that make these masks. Prestige Ameritech is the main supplier of the United States. On a usual basis, they'll make around 1 million masks a week, a little bit more than that, maybe 1.5 million. And so right now they have ramped up their production, so they're making about 1 million a day. But obviously, you know, that's not nearly enough. And so it's difficult because the respirator manufacturers have long been saying that this was going to be a problem when we have a pandemic, that they weren't going to be able to ramp up production quickly enough because they just, don't have the equipment to ramp up production to that degree, nor do they have the personnel. And so they actually started advocating for this back during the SARS epidemic in 2003. And you can look in the news for Prestige Ameritech and their, let's see, I'm forgetting what his name is, but their CEO has tried to make the case that the respirator manufacturing companies need a little bit more help from the federal government to address this exact issue that you brought up, that we need to not be so reliant on other countries for these critical medical supplies. And in terms of why they're so hard to make, it's because of some of what David was getting at, is that they actually have an electrical charge in them. That's because of this material called melt-blown polypropylene. And so simple surgical masks are just some cloth and paper materials that are then folded together to give it a little bit more density, and then ear loops attached or head ties attached. Whereas respirators have this additional layer that's within the respirator that has a negative charge to it, that basically blocks out, in the case of N95s, it blocks out 95% of particles that are smaller than about 0.3 microns. And so in different circumstances, you can get up to 99% of particles that are being blocked out, or even 99.9%, requires thicker layers. There's other types of respirators as well that can block out different kinds of chemicals. But in the cases of healthcare workers, what we're really focused on are these airborne viral particles that, generally speaking, have negative charges. And by incorporating these pieces of melt-blown polypropylene, it makes it much more complicated to manufacture. And there's only a few manufacturers in the United States that can do it. And thus we're left with relying on supplies from overseas. But I agree with you that this is something that we should probably look at changing in the future.
And yeah, I think, if you go on the GetUsPPE website, actually, it's such a well-designed website in the sense that, I think as almost anyone, it's super clear and easy to see how you can help. You can either volunteer when you're on the ground, you can give directly PPE equipment. You can, as part of the maker community, actually try to produce material, or you can donate financially. So I think it's really good on that end. But also, I think you go really through the types of protective equipment that is needed, and and one can really kind of take a look there. I think one thing that I've recently shared the website with a few friends of mine who are trying to do something similar to set it up potentially for the prison system, because I think there you have a very similar problem of currently it seems kind of totally insane. They're trying to implement social distancing. Really, the opposite of it is occurring. Most of the prisons have gone on lockdown, which basically means for the camps where 300 people are locked into one room, that now they don't go out at all, but they're actually now staying in the whole time. Even though they say they do staggered mealtime, they actually do the opposite. So it's kind of a total mess. And I think, David, you brought up the Lompoc case. It is kind of insane that many of the cases that a big fraction of the cases from different states are actually from their prison population. So it seems like it's really a catastrophe in the making, and one that's slowly unraveling. So I'm wondering whether of any efforts in that area, or whether of people that have looked into creating almost like a website like GetUsPPE, but potentially extending it to prisons too. Because from what I've heard from the inside is that many people there seem to be of the belief that they have the stock, but they're not handing it out. That's one thing I've heard. The other thing I've heard is that they actually handed out a surgical mask to inmates, force those inmates to wear them, but they've been wearing the same mask now for, I think, 3 weeks. And meanwhile, the staff in prisons are not wearing any masks, even though they are probably the most likely case of the folks that would bring it in. So
Right.
it seems like also kind of like a slow catastrophe in the making. So I'm wondering whether you know of any efforts to extend it to that type of population at all.
Yeah. I mean, I think if you were going to put anybody within a prison system in a mask to help prevent the spread of the disease from the very start, you would have the prison guards, because they're the only ones with contact with the outside world. And so they are the ones that should be wearing the masks from the very beginning. I know GetUsPPE is interested in helping jails and prison systems, as well as immigration detention centers. The barriers that we've come up against is, even if we hear about needs in a particular location, trying to coordinate with, generally speaking, kind of state-run organizations. Not always, some of them are privately held, but at least, state, affiliated with the state. And it's been, I think, a little bit difficult figuring out how to network with those organizations. So yeah. If you know of contacts, like, we're happy to be able to reach out to them in order to figure out how we can help, because it's very much within our organizational goals to be reaching out to prisons and jails and immigration detention centers to, recognizing this massive need. They just published a study recently. Cook County jail system has 70% of their inmates that have infections. So yeah, it's a huge problem.
It's a huge problem. I think generally for prisons, you have to go via a religious organization to make any donations, for example, for instruments and stuff. I don't know how that works with masks, but yeah, I could see that they would be more reluctant on taking it, because it would mean that they are openly admitting to have a problem. But at least trying to collect data on who's on who's willing and who isn't. I think that would be good. And I think currently, one thing that struck me from what you previously mentioned is, in Oregon, actually kind of like the local authorities kind of like shipping their equipment that they have spare, to help other other states. That sounds like a super laudable, but also kind of like insane effort. Do you have more of like, do you have a good grip of like which states are really good prepared? Where do you kind of like currently see the most need for people to step up?
Yeah, the states that continue to have the most need, New York's outbreak is decreasing, although they're still having a lot of cases. Their ICUs are still quite full, and so New York is could continue to have PPE needs. I think because of all the news coverage that they've received, their supplies at this point are better than other places that are in similar situations. Michigan would be one of those. Detroit's outbreak has also been quite severe, and affecting quite a lot of the marginalized population there already. Florida, I think, has been bad as well. I'm not sure. Our reach in terms of an organization, we're still trying to build out, so we've not heard as much from Florida, but I don't think that that's because they don't have PPE needs. Other states, Texas, I think Texas is a little bit different, at least in Houston, because they had Ebola patients there not too long ago, and so they're slightly more prepared than some other places are.
Florida seems crazy. You'd think that. Do you think they just haven't reached out to you for idiosyncratic reasons? Because it does seem like there should be a major demand like popping up any time. No?
Yeah.
Florida is hot and humid. Hot and humid means very low transmission.
Yeah, I think that's what some people have said. I haven't seen have you seen a scientific study on that, or is that just?
Yes, I have. I'll post it onto the screen in a second here. If you
Yeah.
But in terms of like the age of the population, they would qualify for higher risk bracket, right?
Yeah.
And I mean, you know, I like from the website I see that, you know, it shows that, you know, the majority of surveyed institutions have less than 2 weeks of PPE supply remaining. I'm wondering, do you already see, like, my immediate kind of like worry was, okay, maybe in the beginning people are stepping up the help, especially for places like New York, which are well covered. But then over time, you know, attention spans shift. So do you already see that? Do you already see people donating less, or do you already see like donations going down? Because if the majority of institutions run out in 2 weeks, like this problem won't go away, but it may not be the same amount of coverage, right?
Yeah, and that's definitely what we're seeing. You know, the coverage I think has tailed off first. You know, news organizations in particular are less interested in covering our story, especially as people get more interested in the economy reopening and, you know, people protesting on the streets. I very much hope those people don't end up getting infections, but I can't help but see them standing on the street corner screaming and not thinking that you know, they're going to be seen in the ER in a couple of weeks. Yeah, it's frustrating because we're at the point where the curves in most of the country have flattened, but we're also at the point where we're starting to explore, okay, now that the curves are flattened, how do we reopen? And as you discussed yesterday, a lot of that centers around testing and knowing how bad the outbreak is in certain areas, and then the huge issue of then contact tracing beyond that. Because if we reopen beyond, you know, before we really understand the dynamics of the disease in a certain location, you're risking then having a spike in diseases beyond what the hospital system in that area can manage. And in those situations,
you're a professional in this area. I need you to clarify something for me, if you don't mind.
Well, let me finish with my thought there, because if you have a spike, you know, your 2 week estimate of PPE is going to be destroyed. You know, that 2 week estimate is going to go down to 2 days, and so that's the issue with, you know, opening up the economy and letting people go about their usual business before we're ready to.
I have a question.
Yeah.
Recently, the governor of New York, as I understand it, said that it looks like, based on their recent testing, that something like a quarter of the people in New York have gotten the virus. And of course, most of them have recovered. And we've seen similar studies that came out recently from Santa Clara, Stanford, the South Bay. Of course, everyone's trashing them because they don't like the idea that this is doomsday, right? But whatever. Okay, the idea that there's large fractions of, that there's a much larger fraction of people. Okay, my question, let's just ask the question. If a significant fraction of the people, whether it's 10% or 25% or whatever in some area, large metropolitan area, have not only gotten the virus, but many of them recovered from the virus, to what extent is contact tracing either realistic or beneficial? Like, once you've got millions of people in the area who've had it, does contact tracing, is it worth the effort, or do we need something else?
So, great question. In terms of contact tracing in areas that have already had massive outbreaks, it's definitely less valuable than it would be somewhere like Oregon, where there's not been a massive outbreak. In places where there have been massive outbreaks, what would be useful would be antibody testing that was reliable, and then to follow that up, you would need to then do kind of studies that are continuing to look at those people that are supposedly immune, and making sure that, in fact, yes, you know, having antibodies gives you protection. So contact tracing is definitely going to play a role, and I think it's just going to be a little bit different depending on the size of the outbreak and the number of the percentage of population that has been previously infected.
Yeah. I mean, probably in an ideal case, we would also, you know, much like, because you talked about reopening the economy again, you know, actually have enough PPE or at least masks that, you know, enough folks could wear them too, to slowly start going to work again, or protest, or whatever they want to do in a safe way.
Yeah.
But for that, we definitely, I think, really need to ramp up. I think I'm very cautious of the time. It's now 7:01. I would love to kind of like, if people were watching this and feel inspired to help, what, are the crucial things that you need right now? How could people most be able to help? I know that I want to direct everyone to the website because I think you have a very good FAQ, and even on the main page, it's written out quite clearly. But what are like the main points right now which you still need help with?
Yeah, I mean, we need help kind of across all segments of the organization. We have regional affiliates in case people want to be involved kind of in the on-the-ground effort of getting PPE to where it needs to be. It's basically just, picking it up from where it is and delivering it to, whether it's hospitals, nursing homes, ideally prisons and jails as well. In addition to that, there's other opportunities. We can always use more people to make phone calls, to try to reach out to their senators, to get their, friends to reach out to their senators. Those phone calls have actually gone a really long way in getting people empowered, more aware of what the situation is. We've seen a lot of movement actually in terms of trying to get legislation around the Defense Production Act. But rather than Defense Production Act, it would go through the legislation. So we've seen a lot of movement, and would love to have anybody that's interested in volunteering on either of those fronts involved. And in addition to that, our kind of database folks are still looking for volunteers. So anybody that wants to donate some time, we're happy to have their help, and we just encourage them to go to our volunteer page and fill in the information.
Wow, it's fantastic. I mean, I have to say, from the volunteers that I have interacted with, they were incredibly on top. I don't know, it's just, I think it's insanely hopeful, I think, for me to see how in such a situation, people are just stepping up randomly to do the right thing, get together, and it works kind of like, it works as if this has been a company in the making of like a few years or so. So I really applaud you and really admire you kind of stepping in, and I think we need much more of that. I will share the link to the website in the show notes. Thank you so much for taking the time. It's really like a fantastic effort, and yeah, we would love to help spread the word in whatever form possible. Thank you for taking time, and I'm hoping that over the weeks, we can kind of like just continue to stay on the ball in that effort.
Yeah, thank you so much for having me. It was a very good conversation.
Yes, thank you so much.
I have to look into some of these links that you all shared.
All right. Thank you, everyone. Have a lovely evening. Bye-bye.